This is Attorney Michael Leiner. I'm here this morning with Dr. Sarah Prosak. Dr. Sarah, do you want to introduce yourself and tell a little bit about what you do?
Sure. I am a doctor of chiropractic. I received my license in 2011, so I've been practicing for about 7 years now. And as a doctor of chiropractic, we specialize in the neuromusculoskeletal system, which means any ailment, pain, injury that deals with the nerves, the muscles, or the joints, we got you covered.
Now, you're a doctor here at Advanced Orthopedic and Physical Therapy, but we're here in a new office today, aren't we?
Yes, we actually just expanded. This is our third location. We are now servicing the west side of Cleveland, which is pretty awesome. We've been treating in Warrensville Heights and Euclid for about 5 to 7 years, depending on which office we're talking about.
Okay.
So.
And are you from the Cleveland area originally?
So I'm originally from the Akron-Canton area, but I do live in Fairview Park.
Okay, so you live probably pretty close to the new office.
Yes, it's been awesome. I've been able to cut my commute down significantly.
Oh man.
From driving to Euclid every day.
Probably a half an hour, 35 minutes
gosh.
to just a couple minutes.
You
That's
got
great.
it, yeah.
So tell us a little bit about the practice here and what makes it different than other chiropractic or physical therapy offices, because you're not just you have medical doctors on staff.
Correct. So one thing that makes Advanced Orthopedics pretty unique is we don't only have chiropractic services, but we also have full physical therapy, medical, massage therapy, and acupuncture services available. So it's a pretty phenomenal environment. Sometimes patients come in and they don't really know what the best means of treatment is going to be for them. And if you go to just a traditional chiropractic office, they really only can offer you the services that a chiropractor would provide. Here, on the other hand, if someone is starting chiropractic treatments and not seeing the full benefit or not getting the results that they would had anticipated, we can look at a lot of different avenues. So we can say, hey, why don't you sit down with our medical doctor and see if he or she has any other ideas of what's going on here, or let's see if maybe physical therapy is a better route for you, or sometimes even doing a collaboration of all of them combined really does help get that patient to the next level of recovery. So that's one really, really awesome thing that we have here.
Now, one thing that you and I talked about earlier that I just find so interesting, and we talked about how one of the things that I spend a lot of my time doing is lobbying to expand Social Security's definition of who's an acceptable medical source, because currently they don't consider chiropractors or physical therapists acceptable medical sources to diagnose.
Okay.
To treat is okay. And they're supposed to review treatment notes, the Social Security Administration, when deciding a disability case, but they don't consider DCs or PTs acceptable medical sources to diagnose. Are there any thoughts that you can offer on that? We had a cool conversation earlier.
So the thing about chiropractors is, like I had said before, we are specialists in those three main areas: nerves, muscles, and joints. So if your disability is a physical disability, we by far have such expertise in those areas that we can identify if somebody is in fact suffering from a disability that is not likely to improve or get better in the long term. If it's something else like a visceral issue, like let's say somebody has COPD or asthma, or if it's something related to a mental health issue, obviously that is not our specialty. But when it comes to physical disabilities, that is right in our wheelhouse. So there really should be no reason why we cannot diagnose and make a projected kind of like opinion about that.
Well, and sometimes, and I guess more on the physical therapy side, do you guys ever do functional capacity evaluations here?
Yep.
So something that I always find so fascinating is whenever, and especially in a disability case when I'm working it up, functional capacity evaluations, FCEs, are so important, but doctors refuse to do them. So they refer the patient or the client to be seen by a physical therapist or a DC, and then a judge reviews it and gives it minimal weight, even though the doctor passed the buck to the DC or the PT to give the opinion. And the notes that we see from chiropractors and physical therapists are just so much more detailed and precise than the medical doctor
Yeah.
notes so much of the time.
Yeah, and you have to remember, like a medical doctor, unfortunately, the way that the healthcare system is going, they have such a limited amount of time with each patient that they're really just touching the surface of the issue. When you come for a physical or like a functional capacity exam, that is like a 3-hour test, and they're going through everything. Can the patient sit? Can the patient stand? Can the patient use their fine motor skills? Can they follow directions? Is pain a limiting factor? So a lot of times the doctors are referring for these types of tests because they don't have the time or the knowledge to kind of delve into some of these really small little details.
Right.
And that with that respect too, the medical doctor will then take this test, read the very small last little section of the report, and base their whole opinion about the patient's disability off of that. So really, do you need the doctor to interpret the results of a test performed by another professional? So that's kind of where we're going here.
Well, we spend so much time in our office trying to get doctors to fill out medical source statement forms, getting opinions about what my clients can and can't do, which is exactly what an FCE does. And basically what we do at the end is if the client's been referred for an FCE is I just then send the FCE to the doctor and ask them almost like interrogatory style, do you agree with the opinions?
Correct.
Are they correct to a degree of medical certainty? Because that's apparently what Social Security cares so much about. And I've never heard anybody say, no, I disagree with
this 3-hour
whatever that
test
said.
that I suggested.
Now, your practice is in Cleveland. You live here in Cleveland. Tell us some of the things that you love most about living here in Cleveland.
So growing up in Akron Canton area, it's been pretty fun, like living closer to a bigger city. There's so many different like opportunities. We have all the sports teams, we have great food, we have great like theaters and all the great musical artists come here. So really, I mean, the metro parks are phenomenal. I treat a lot of athletes, so I'll be walking in the metro parks and I'll see 3 or 4 patients. Hey, how you doing? Which to me I love because it's almost like practice what you preach. Get out there, be active, exercise. So Cleveland just has so much to offer. And I'm really happy that our company, which is phenomenal, is able to now service, the west side. Because before it was such kind of like if you didn't live on the east side and it wasn't convenient, it was hard for you to get to us.
And are you finding that West Siders are starting to come through the door
Oh,
and be
yeah.
receptive to you guys being here?
Yeah, so it's pretty interesting. When I first got into practice, I was working on the west side.
Okay.
And it's been interesting because I practiced in Euclid for the past 5 years, and I had a lot of those original patients follow me. So I've had people driving from Westlake, Bay Village, Avon to Euclid.
Wow.
Yeah, so they're thrilled. And it's also been pretty cool because now they're able to send friends and family that otherwise wouldn't have traveled across town.
Yeah.
So.
Last question I want to ask you.
Sure.
Many of the people that will be watching this are clients of ours that are
Okay.
going through the disability process.
Yep.
Is there any advice that you can offer them?
Yes. So a lot of times when you're dealing with these disability claims, you get really discouraged and you hear a lot of people, saying there's nothing else I can do for you. One thing that I will say, and I have an identical twin sister who's family practice.
Yeah.
And she and I frequently talk about cases and whatever, and she says, Sarah, the first time you hear a doctor say there's nothing else you can do for me, she's like, go somewhere else. She's like, doctors' jobs, myself included, we are problem solvers, okay? So if you haven't found the solution to the problem, you have to keep looking. So, you may be disabled, you may have a lifetime disability, but that does not mean give up. Like, keep looking. You can find other things to try. If it's not to cure, it's at least to manage or to cope or, always have that little sense of hope. There's always something else that you can do, whether it's nutritionally, whether it's, think outside the box, acupuncture, massage, taking care of your mental health if you're starting to be depressed. So there's always more that you can do to feel better and kind of make your life a little bit more vibrant, even if you are diagnosed with a disability.
I think that's great advice.
Yeah.
Thank you so
You're
much for your
welcome.
time today. I really
Yeah.
appreciated the opportunity to talk to you and for you to kind of share about what you do.
Right, yep.
Thank you.
Thank you.
Finally, girl, the disability warriors fighting for those who cannot fight for themselves.